Welcome to Robert Wood Johnson University Hospital, Somerset's Health Talk. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. In accordance with social distancing due to the COVID-19 pandemic, I am hosting this show from the studio, and our guests will be joining us remotely via video conferencing. Our gastrointestinal system plays an important role in our body, helping to absorb nutrients from our food and remove the waste. Cancers in the gastrointestinal system are a common health concern, with 4.5 million deaths each year. They comprise the second leading cause of cancer death after lung cancer. On today's show, we will learn more about some of the most common forms of gastrointestinal cancer, how to reduce your risk, and the importance of early detection. We are joined by Dr. Eshan Patel, a board-certified hematologist-oncologist with the RWJBarnabas Health Medical Group, who sees patients at the Steeplechase Cancer Center at Robert Wood Johnson University Hospital, Somerset. Thank you, Dr. Patel, for joining us here today. Thank you, Dr. Patel, for being here. First, to start off for the audience, can you give us a little bit of background on who you are, where you went to school, and how you joined the Steeplechase Cancer Center?
So, my name is Eshan Patel. Thank you for having me on the show today. I'm blood and cancer specialist working at Robert Wood Johnson Somerset Hospital, which is located in Somerville, New Jersey. Prior to joining Robert Wood Johnson, I was working for New York Presbyterian Healthcare System in New York, which is associated with Weill Cornell Medicine, where I received my medical and oncology training.
So tell us a little bit about, you're involved in gastrointestinal system and gastrointestinal abnormalities. Can you tell us a little bit about the gastrointestinal system, how it works, the organs, functions, and any other information that the studio audience would like to know?
Sure. So the gastrointestinal system consists of your hollow muscular tube that transport the food around your body. It starts from the oral cavity to pharynx to the food pipe, which called esophagus, takes the food down to stomach, to intestine, and out in rectum to anus, where waste is expelled. It helps us break down and digest the key nutrients from the food and excrete the waste products of digestion.
So again, for the audience itself, the oral cavity, the mouth, going into the pharynx, which is the neck area, the throat, going down the esophagus, as people call it, the food tube, going into stomach. From the stomach, going into the small intestines, attached to the small intestines, the liver, the pancreas. From the small intestines going into the large intestines, which most people call the colon, and then out the anus, the rectum, and as you said, we consume food through the mouth and expel it when we have a bowel movement.
Right.
Now, since it is one of the larger organ systems in the body, can you tell us a little bit about cancer of the gastrointestinal system, where people should be, what people should know about it?
So they are the most common cancer. It's the third most common cancer in the general population. People should know that it can cause a cancer. The colon cancers are very common and is related to a lot of the risk factor that we have exposed in our daily lives. People should always be vigilant about if they see any changes in their bowel patterns, if they see any changes in their daily routine, if they're more fatigued, they're losing more weight than usual, if they see blood in stool, all those are red flags, and that should be evaluated by physician right away.
So again, the important things for the people to know is, one, weight loss. Again, very, very key. You're eating, but you're either not maintaining the weight and you're losing weight, or you don't even feel like you're eating. You have what the physician would call anorexia. Number two is that there are changes in the bowel itself. One, whether you're having anything, where you eat and then suddenly you're having intestinal, upper abdominal discomfort, distress, gas, belching, etc. May not be related to a cancer. It may be something functional or due to foods, etc., but something that should be looked into. But more importantly, anything that's eliminated through the colon, if there's a change in the bowel habits, whether you're becoming constipated, whether they're becoming more liquidy, whether you're noticing stool in it, or that you're noticing that you used to go regularly and now you're going every 3 days, it's something that should be looked at first by your primary care physician, and if necessary, then referred to a specialist. And what can people do to help reduce their risk of gastrointestinal cancers?
So there are multiple risk factors for developing colon cancers, which includes obesity, dietary habits, smoking, alcohol, personal history of multiple polyps, which is the abnormal tissue growth in the colon, personal history of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, or any kind of familial hereditary condition that put them at the high risk. Now, some of the risk factors that we can change and act on, the familial one or hereditary conditions that runs in the family, we can be more vigilant about screening. But some of the key risk factors that we can change are obesity, dietary habits, smoking, and alcohol. So good active lifestyle that includes exercise few times a week definitely help your overall sense of well-being. It also has a direct stress bursting benefit. So I will definitely encourage everyone to keep active lifestyle. Good dietary habits is very important. Cut down as much as red meat from your diet. Also cut down on the processed food. Your diet should consist of fresh vegetables, fruits, lean meats, and avoid alcohol and avoid smoking.
Okay, so it's again, a lot of it is going to be based on the same type of criteria, dietary criteria that we say for and many of the other conditions that we try to reduce. You want to cut back on the red meats as much as possible and more fish, chicken, vegetables. Again, especially during the summertime, eating good, healthy New Jersey peaches, plums, corn, anything that's not processed is great. You go to the fresh market, go in there and enjoy yourself, especially during the time of year when everything's coming out. And then, of course, during the winter time, you go there and get the stuff coming in from the south part of South America, etc. But a good, healthy diet is very important because whatever you put in through your mouth is going to go through the whole intestinal system. And the less processed foods that we put in and the more vegetarian type of things that we do, the less red meats that we put through it, which are harder for the body to metabolize, will be better for the digestive system itself. It's reducing the alcohol, of course, not completely getting rid of it, but reducing it to a minimum. You can speak to your own family physician or internal medicine physician about what they think is the right amount of alcohol to have during the week on weekends, and try to avoid the binge drinking unless the New York Giants or the New York Jets win a Super Bowl. Then we can give them a little bit extra for that. Also, cigarette smoking. As everyone knows, cigarette smoking increases a lot of the cancers. And again, something to help reduce is to cut back or eliminate cigarettes as much as possible. We don't know a lot about e-cigarettes, etc. So again, trying to keep that to a minimum is also very important. Now, things that people need to understand is how do we detect these things so that we can reduce them from occurring, or if we do find them quicker?
So there are multiple screening options. So screening is very important. Why those early detection is important? Because most colorectal cancers arise from the polyps in the colon, which is the abnormal tissue growth. Those polyps are usually precancerous, so it can progress in size and eventually can turn into invasive cancer. Screening can prevent colorectal cancer by detecting and removing those pre-malignant polyps before they even progress to cancer. There are multiple screening tests available that we can talk about. The most common everybody knows is the colonoscopy. Screening tests usually helps improve disease prognosis by early stage detection of colorectal cancer even, because if you detect them at early stage, you can treat them earlier and have lower mortality rate compared to patients who get detected in the later stages.
Again, the nice thing about what you just described is that this is one of the few cancers that we can actually help reduce the risk of by finding abnormal cells earlier. So screening is very, very important. Now, years ago, of course, we used to do flexible sigmoidoscopes, barium enemas, and we used to do 3 hemocults in order to detect colon cancer. And then we used to do the colonoscopy, and at that point we were doing it every 2 to 3 or sometimes 3 to 5 years. But with more and more research on the matters, we're finding out that there are better screening modalities for them. And again, the things that we have to remember is that people who have familial type of cancers or have familial polyposis in their intestines, they have to be screened differently than the average American. So for the average American, again, we would love to have everyone have a screening colonoscopy at age 50. And then based on the results of that screening colonoscopy, determine when the next one is. If we don't find anything, then the next one usually is going to be anywhere from 7 to 10 years. And then once we hit age 75, we usually don't do colonoscopies anymore unless there's a change in the bowel movements. At the same time, again, we used to do the 3 hemocults. We no longer do the 3 hemocults now. We have both the fecal immunochemistry test, or we have the Cologuard system, which are very helpful as screening tests in people who don't have an increased risk of colorectal cancer. Is that correct?
That is correct. So the U.S. Preventative Service Task Force strong recommendation for everybody to get colonoscopy at age 50. Some of the racial group also benefits if we do it early at age 45. So African American people usually have high incident of colon cancer, and the recommendation is a soft recommendation, but they can start screening early, even at age 45. Also, if you have a family member with a colon cancer, you should also get colonoscopy screening earlier, 10 years earlier than the age of diagnosis of that first degree relative.
Again, important things for the people to remember, that if they are African American, starting the screening at age 45 rather than at age 50. And also the fact that if someone in your family has a history of colon cancer, getting that initial colonoscopy at least 10 years earlier than when that person was diagnosed with the condition.
Right.
Okay, so how do we treat colon cancer?
So it depends on the stages at diagnosis. Early stage cancers can be cured just by surgery. So if you detect it early, and that's where the screening is very important. If it's stage 1, stage 2, you can just get surgery and be cured from it. Localized colon cancer can be cured with surgery and chemo, plus and minus radiation based on the site of the cancer. Widespread cancer, usually what we know as metastatic cancer, usually treated just with chemotherapy. So it's a different modality.
Again, very important that if we catch this early enough, the fact that we can actually cure cancer with a surgical procedure, very different than most cancers that we have in the rest of the body. If they become more invasive, of course, we do have more modalities that we add to it.
Correct.
Now let's move on to liver cancer, since people have been sometimes talking about it, but the people don't know a lot about it. So can you give us tell us a little bit about liver cancer, its prevalence, what we should do about it?
So every year there is around 40,000 cases of liver cancer in the United States. Liver cancer is the 6th most common cancer in the world and the 3rd leading cause of cancer death in the world.
And tell us a little bit about how we detect it and how we diagnose it and what the prognosis is.
So the most of the liver cancers occur in the patients who have some form of underlying liver damage. Those patients are usually one with who have hepatitis B or C infection, which is known to cause liver cirrhosis. Also, other risk factors such as alcohol-induced liver damage, fatty liver disease, obesity, diabetes, those are highly associated with liver cancers. How do we diagnose liver cancer? Usually, people who are at high risk of developing liver cancer, patients who have those risk factors I just described, they do get serial imaging like CAT scan or ultrasound by their primary doctors every 6 months, along with the tumor marker that helps us to know if patient is developing some form of liver cancer. People at high risk should be getting tested every 6 months for those tumor markers and the imaging studies. Once there's any form of suspicion, then we do better imaging modality like MRI to better evaluate those lesions in the liver.
So again, so the importance is, again, we go back to reducing the alcohol consumption, reduce other types of abnormalities in the patient, keep the diabetes under good control, and again, the alcohol, reduce it so that we don't end up with cirrhosis, etc. In addition, the hepatitis, understanding how important it is that if the person has had hepatitis B or C, that they are followed up by both their primary care physician, possibly even by their gastroenterologist, and if there is any suspicions, getting them over to the Steeplechase Cancer Center so someone such as yourself can follow them appropriately using the cancer markers.
Yes, we do keep very tight check on all those patients, and we make sure every month they get serial imaging to look for liver cancer.
And what people really need to understand is how important it is to have the Steeplechase Cancer Center at RWJBarnabas Somerset Medical Center, a terrific place for the treatment of cancers, the diagnosis of cancers, and for having specialists such as yourself there who can follow these things and guide the treatment of it. So can you tell us a little bit about the Steeplechase Cancer Center and the gastrointestinal services that are offered there?
So Steeplechase Cancer Center is a comprehensive cancer facility. We have expertise here and warmth and touch of that community feeling. Steeplechase has excellent multidisciplinary team that approaches to treat GI cancers, such as surgeons that are dedicated for GI surgeries, radiation oncologists, medical oncologists like myself, and pathologists that are trained, highly trained to look for molecular markers that are very important for certain GI cancers. You get state-of-art care here. All the resources are available, such as genetic counseling, social work support, dietitian, cool cat therapy to prevent hair loss. All is provided under one roof. There is a passionate and motivated staff, which makes the journey of our patients smooth and warm during their most needed time.
And what's nice is that you're embedded within the community itself. They're not having to travel into New York, get into a tunnel, be in the tunnel for an hour and a half, get into the city, try to find parking in the city at another facility, and constantly be going back and forth, spending hours on time, and especially if they're undergoing treatments, having to spend all that time, effort just on the transportation in order to see someone. We've got it embedded within the community, and there's no reason for them to actually have to go into the city to get that treatment in the city.
We have all those resources available right in the community. We have expertise here, and we have a strong partnership with Rutgers Cancer Institute, which help us give that precision care to our patients. Today in oncology, there are many targeted therapy, many immunotherapy. We personalize the treatment based on each patient's cancer genomic profiling. And Rutgers Cancer Institute partnership help us develop a lot of those outstanding research and clinical trial right here in community that helps our patient to get new innovative care and enhance their cancer response and survival without traveling far away from their houses.
And again, this whole partnership with Rutgers Cancer Institute of New Jersey basically streamlines things, allows the patients to get the best possible care that they can anywhere around the country, and it's embedded within the community so that they have all of the resources, the social service resources, the home care therapy if necessary, and they actually can park in the parking lot without having to pay for the parking in the parking lots. Even those simple little things make such a big difference, especially when you're having to think about everything you think about when you have cancer.
Right. And we have a great social work support, group support. They arrange for a lot of transportation issues. As you said, parking is very important. And we have everything available here. The first visit with the patient, that they get introduced to the entire team. They get to meet their patient navigator, which helps them schedule all their tests, all their treatments. So they have all the help that we can provide.
And in fact, that patient navigator is such a big thing for this. The fact that they have someone that they can actually get in touch with. And many people, after they finished all of the therapy, et cetera, and are in either remission or cured from the Steeplechase Cancer Center, say that the first thing they want to do is hug that patient navigator who got them through this journey.
Yeah, they're a great help to the patients, from putting them in contact right away with the treating physician if they're having any symptoms, to help them get their test scheduled, to help them get transportation to come to therapy, to get them any kind of social work support, everything. They are like patient's best friend and help them get through everything very easily.
So again, it allows us to give them top-of-the-notch care in affiliation with the Rutgers Cancer Institute of New Jersey at the Steeplechase Cancer Center at RWJBarnabas Health in Somerset. It allows them to get the same type of care as they would have gotten if they drove into the city or flew across the country. And at the same time, you have tumor boards, where everyone gets together to discuss it, and basically you get second and third opinions all in one time. So it's as if they traveled and got other people's opinions.
Right. So it's a multidisciplinary team approach where surgeons, radiation oncologists, medical oncologists, pathologists, radiologists, they all get together. And not only from this facility, from the facility of CINJ, and sometimes we even have a guest from the other institution, and we all review those cases together and make a treatment plan. So it's a multidisciplinary team approach, and that works very better for patients when the whole team come to the conclusion together.
And everyone is on the same page. No one is worried that they're doing something that's not in key. And the other thing that they allow is that if the patient's primary care physician wants to, they're able to attend there also, and they can also hear what the final plan will be, so that they can also help interact with it.
Yes. So we invite all the treating physicians who are involved with that patient. That can be their lung doctors for lung cancer, to GI doctor for any GI malignancy, and their primary care doctors. So it's everybody's input is taken, and everybody's aware what's going to be happening in terms of the care for the patient.
So, do you have anything that you want to offer? What things that the patient, anyone who's listening here today, certain go-away points, what they should know about?
So I think I will start from the beginning. As I said, screening is very important. You have to make sure you do go to your primary care doctor especially at age 50, and make sure you get a screening colonoscopy. Screenings are important because, as I said earlier, that it can detect the precancerous or even detects the cancer at the early stage, which has better prognosis. Keep an eye for all the red flags, as we mentioned, weight loss, any change in bowel habits, any blood in stool, any of those are red flags and you should bring to your doctor's attention right away. If, God forbid, if you ever diagnosed with any form of cancer, if you're in this community, we'll be glad to help you. We have a top-notch treatment team here, and we'll help you get through it, and we'll make sure we are here to help you throughout the process.
So for the audience, the important things are, one, diets. Making sure that we try to reduce the red meats, processed meats, and increase the fruits, vegetables, fiber, chicken, fish, things like that. Two is cut back the alcohol to a normal amount that you and your primary care physician think is appropriate for you. Three is to cut back the cigarette smoking or eliminate the cigarette smoking completely. Because again, all of those could increase the risk of developing any abnormalities. Four is if there are any changes in your bowels from either you're losing weight, you're not able to maintain weight, or you notice changes in your rectal movements, bowel movements, bring that as soon as possible to the attention of your physician. And he may or may not want to send you over to a specialist to have further testing done. We're up to five. Five is that if the specialist and or primary care physician do have any questions, concerns, a referral to RWJBarnabas Health Steeplechase Cancer Center is something that people should really think about. It's a multidisciplinary approach at the center, at the facility, which allows the patients to achieve top-notch care with top-notch physicians, top-notch specialists in a community setting, and allows the patient to have the least amount of tension, buildup, driving, etc., and getting the best care possible.
Yes.
And you, Dr. Patel, is one of the excellent specialists who are there, who does come from a top-notch facility himself prior to coming to RWJBarnabas Health. The fact that people like you are at the Steeplechase Cancer Center just show how important RWJBarnabas Health believes that the Steeplechase Cancer Center embodies everything that is the philosophy of RWJBarnabas Health.
Right, and I grew up in Somerset, New Jersey, so it was time to come back to community and help the community. And I think the philosophy of Robert Wood Johnson to give that excellent care in the community so patients don't have to travel further. And I think I abide by it. Why in the time when you are very sick, getting treatment, you should not have to travel so far. It takes toll on you, it takes toll on your family. I think we are here to help, and that's why the community where we provide all the care so you don't have to go anywhere. We are right here for you.
Thank you very much, Dr. Patel, for being here. Thank you for everything that you provide at RWJBarnabas Health's Steeplechase Cancer Center. And I'm sure all of your patients are thrilled to have you as one of their top-notch physicians.
Thank you. Thank you for having me on the show today.
This concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 888-724-7123. For more information about cancer services at Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset.